Hi everyone, this is Ricky Spencer, and welcome to another Sociology of Media Voices series. And today our special guest is James Fowler, and they are a Doctor of Philosophy candidate within the University of Queensland School of Public Health. Their work involves the use of mixed methodologies and community-based participatory research to address the mental health needs of communities, with a specialist focus on LGBTIQASB issues. Their focused PhD is on the co-design and implementation considerations of a web-based acceptance and commitment therapy program for our community. And as we unpack that, can we hear from James in easy read language? What does that mean?
So we're working with community to take a program that is designed to help support people's mental health. And I want the community to rip it to shreds, really strip it back to its barest bones, and together we rebuild it into something that is affirming and effective and really meets our needs as a community.
Wonderful. I just wanted that so we get right from the go. So James, tell us a little bit about yourself. What got you to where you are today?
So I am originally from the UK when I moved to Australia when I was 10 and grew up in a regional town. And it's a very stereotypical story of I started to get weird feelings towards boys and slowly realized that it was, I was a gay man and didn't have any kind of visible mentors or community to engage with. And that was my story for quite a while. And then growing up and moving to Brisbane, I still didn't feel a connection to community and I didn't feel like I belonged in many of the spaces. So I spent a great deal of time being a gay man, but feeling like the only gay man in the world that I knew. I completed my undergraduate degree in psychology and I had this yearning my entire life, but particularly when I finished, to provide mental health support to people and to use my own lived experience to help support people who can't just go to any psychologist and get any form of treatment. People have had a real contextualized need and desire for mental health. And so I tried to pursue a master's program 3 times and failed spectacularly 3 times to get into the programs. And it called me to consider, what do I want to do and who do I want to be and how can I help? And through that journey, I started working with an organization called Open Doors Youth Services, who are a fantastic LGBTQIA plus organization here in Queensland, and kind of found community for the first time. And speaking with people, I really got to learn about the diversity of our community and the experiences that people have. And in tandem with that, I started to do some research assistant work with my honors supervisor, and I fell in love with research that supports people, that uses, co-design models and literature and learnings from so many people to improve health outcomes and build things. So that started with helping support the design of a mental health program to support people with chronic pain and their management of opioids. And then slowly, I kind of built a research career with a bunch of different people who all have those shared values of supporting people. And I suppose I really fell into this space when I started working with the brilliant Dr. Judith Dean, looking at a bunch of projects within my community, but then also starting my PhD, which looks at online self-guided mental health programs for the community.
It's an incredible journey, James. One of the things I guess I want to ask you right now, and for those who are listening who maybe they don't know many people who are from the LGBTIQ community, or maybe there's some misinformation. Why is there a need to focus on mental health within the LGBTIQ community?
I think it stems, I suppose, from 2 factors. The first one being that within community, we often talk about the shared experience of living in a world that isn't necessarily designed to accept us. And I think within different identities in the group and different experiences, we have a bunch of different factors and fluctuations in the spaces that we're accepted in. I think, for example, for myself as a white cisgender gay man, I'm pretty accepted in any metropolitan city, but I know that when I go into a rural town, I close up as a person. And so I think we have unique challenges and experiences in our community, and those can contribute to mental health problems. And also for me, the need for contextualized community-built interventions and acknowledgement that not every single person will have the same experience. And it's all kind of dependent, I feel, on what environment you're in at the time.
Hmm. And going on to your research, what made you decide those particular research methods?
Mm. So I suppose the digital side of everything for me was because I had no access to mental health support growing up. And my fiance, who is from another regional town, also didn't have that access to mental health support. And it became really apparent to me then that we can use these digital mediums as one way to provide some support to people. Um, and then to use the community-based participatory research design was really essential because we are such a diverse community, and we need all of our brains together on these projects and all of our lived experiences, because what to me would be, a perfect mental health program for you, Ricky, would be very different. And we need those methodologies together as well to make sure that we all have a voice in this. And that we are all active researchers, whether you have a PhD, whether you finished high school, whatever, everyone has a point of view to bring to the table. And so community-based participatory research, as hard as it is to say, is the only way I think we should be doing research with our community. And then for me, the mixed methods approach was because numbers are great. Numbers give us really important snapshots, but words, people's stories, they give us the juicy bits. They, for me, say if we have a stat that tells us, X many people suffer from chronic mental health conditions, people's words and lived experiences color those numbers in, and they tell us why. How does that look? How is it different from day to day?
And is there a difference, James, so far that you're finding in your research or reading in your area, difference between those accessing supports in remote and regional spaces than those compared to metropolitan spaces around Australia?
When you say differences, do you mean like differences in outcomes or?
Or even access, to be able to
Mm,
actually access that the particular service that's sort of queer friendly or
mm,
LGBTIQ embraced.
yeah. I suppose from the research, it tells me that there aren't people who are living in rural and regional areas don't necessarily have those very visible clinics or places that they can access. Whereas in metropolitan areas, there often are a lot more visible clinicians. But I think a pretty unifying thread across, regional, rural, and metropolitan is that in our current healthcare system, it's very hard to access a psychologist.
Mm.
It's very hard to sit with those waiting times. I often find here in Brisbane that the best, most affirming psychologists are within a 5 kilometer radius of inner city Brisbane, which for me, for the young kids on the north side who would have to take a long train to get here, creates a very similar barrier than the kids who live out in Kingaroy or Harvey Bay who don't necessarily have those visible clinicians too. So I think there are definite differences, but there's a lot of unifying barriers to accessing this type of support.
And what are you hoping that your research will be able to do?
When I think of my fiance and I think of him growing up, I think of the fact that if he just had some source of support, it would have helped him a lot. By no means, do I want to replace psychologists, and by no means do I think a digital intervention would necessarily, be adequate, but it's something. And whilst I think community deserves more than just something, we live in an Australia where many people don't have anything. So what I would like my research to be able to do one day is to provide some source of support, to get people through some of the more challenging times and help get them into more comprehensive psychological support.
And James, what would a digital intervention or support look like?
I think our research is telling us that depends person to person. I think what people are really calling out for is that these things are tailored to people's experiences and tailored to unique challenges that the community go through. So in our research, it's often described by our participants as not necessarily being the most important factor, or not necessarily being the thing that would stop them from accessing a program. But when a program is tailored and when a program does consider unique challenges of our community, it is inviting, it makes people feel safe, and in my opinion, would probably long term keep people engaged in something. So I think tailoring to our community is really, really important. But I think there is often this thing in mental health that people want perhaps a magic pill. And unfortunately, mental health is really difficult in that way, that there is no magic pill. And often when you're accessing support, things often feel harder before they get better. And so I think what people are asking for in digital interventions now are things like community connection, access to healthcare providers, and really one-stop shop interventions that provide more than just mental health support.
Hmm. And now, James, you're in the process now of looking for participants for your research. Can you give us a little bit of a description on what you're looking for and how people can become involved?
Yeah, so what we're looking for is anyone who lives in Australia who identifies as a member of the community and is age 16 and above. We did want to get younger people in, but with ethics, it was just really quite challenging. But yeah, they're the target participants, so it's quite a broad range. And for us in our research, it's really important to get people from all over Australia. We want people from metropolitan cities, from regional areas, from rural areas, again, so everyone has a voice. To participate in the study, there's a couple different ways. So we have a website, which you can hopefully will be attached to this interview when we're looking at it. But you're also welcome to contact me directly. I really understand that research in mental health can be quite scary. And I encourage anyone, if you want to participate, but you want to learn more about it from a person, everyone is more than welcome to contact me and we can set up a time to chat if there's anything you need there as well.
And I guess the question I want to ask now is, if people are thinking, but the concern they may have is privacy, what steps have you taken in place to ensure privacy and confidentiality?
Yeah, so the data that we collect from you is stored separately to any email address that you might use. When you sign up for the program as well, you don't have to use a real email. So the email address is used to log in and to receive reminder prompts from the survey about your engagement and that kind of stuff. But if you're not comfortable using that, you're welcome to use a fake one. And if anyone has any issues with that, and it's not working, you can always contact me. With our interviews as well, which can be completed after the program, we do a thorough process of making sure we remove your name, and making sure that we remove any names you mentioned, but also making sure that the stories you might tell us are not identifiable within your community. So we would never publish something that described, I was at a blank fair day in blank year, and, where people could very easily understand, because we're a very small community. So, and if anyone has any further questions about their privacy, you're more than welcome. And I think one last thing to add is that it's hosted by a university. So there's no commercial interest, there's no third-party person trying to buy your data from you. It's all held with very rigid and very controlled policies in place.
And James, what about the time commitment for someone who's thinking about it now, or maybe a researcher who has friends or colleagues that they may want to send? What sort of time commitment are people looking to give you?
Yeah, so we're using a waitlist control design. So some people will log in and complete some measures and then have the program available straight away. Other people will be asked to wait 4 weeks and then log back in, repeat some measures, and then you can have it straight away. The program itself, it's split into 4 different modules, and they're about 45 minutes long. And we recommend doing 1 a week to allow yourself to have some time to absorb the information, but you can take that at any pace that you want to. You just have to complete them in sequential order. So in total, it'll probably be around 4 hours commitment if you complete the entire program, which we understand is a really, really big ask for people to do. And we really hope that the program is beneficial for you, so you do get something out of the experience rather than just contributing to the research program.
Sounds really wonderful, and it's a great way, I think, for young people too to really get an insight into their own health and well-being. And
Mm,
I love the idea that to do it online too, because for many young people, maybe, and older people, of course,
mm,
you can go to your local library, and you can log in safely and do it. So if you are uncomfortable doing it at home, at least you have that option of going to a safe community center and
mm,
perhaps doing it there if you do want to do it on your own computer and
mm.
device. And how long do you envisage, James, this part of your research to take?
Yeah, so ideally, we would like data collected by the end of the year, but recruitment has been a little bit more challenging for us. So I think perhaps 6 more months. So March, but I think by March next year will be our definite stopping point. Um, I think because we're in the parameters of a PhD, at some point I've got to submit that thesis. So yes, I think between the next 3 to 6 months will be our stopping point.
That's wonderful. Well, thank you so much, James, for giving us an insight into this wonderful, very most important project with mental health within the LGBTIQ community. And for those listening, if you look underneath the YouTube, you'll see a links to James's incredible research. Please share that with your colleagues and friends. And for those who are teaching in schools, please talk to your principals and share them with your students, because remember, not every student may necessarily be out there, but they may wish to, this could be a way for them to explore safely aspects of their health and well-being. So thank you so much, James. You're doing wonderful work in the community, and we hope to have you back again to hear more of your incredible work, because here at the Sociology of Media Voices, we really do value voices from the community. Thank you for your time, James.
Thank you so much.